yeah? So, you all comfortable in your seats now?
Yes.
Okay, how about the lighting? How about the aircon? Is that okay?
Yes.
Good? All good?
Yes.
Alright. So later, once I show the slides, I'm going to switch the light in fine, okay? But at the moment, we're going to do a little bit of introduction, shall we?
Yes.
Please tell me your full name and what do you prefer me to call you, how old are you, and where you come from. And if you have any working experience before, please share with me. Shall we do that?
Alright.
Alright, thank you. Come, start with you.
Good morning. Good morning everyone at Juliana. My name is Nora Azra, but you can call me Lara. I'm 19 years old from Bintulu, Sarawak. Before this, I working as a sales assistant.
Sales assistant. Where is it? In which shop?
Mobile phone.
Mobile phone. So meaning to say you know a lot about all this gadget kind of thing. Okay. Thank you.
Hello, good morning everyone. I'm Julia. My name is AZ. You can call me AZ. I just turned 38 6 days ago.
Oh, okay. Happy belated birthday.
Before this, I worked as a clinic assistant, and I was an ex-clinic for 5 flight for 2 years. And I'm a mother of 1 year old.
Oh, really?
Yeah.
Oh.
We just turned 8 days ago.
Oh, really? Okay. Happy belated birthday. So only two days gap between you and your son or your daughter? Your son. Okay. Who's taking care of your son now?
My mother-in-law
Your mother-in-law. Okay. Where is your son?
in Sabah.
In Sabah. Oh, okay. Yeah. So after this training, you can go back there.
Yes.
See him. Thank you.
Hello, good morning everyone.
Good
My name
morning.
is Juliana. My name is Mohiza. You can call me Bobo.
Okay.
And I come from Kota Kinabalu, Sabah. I just turned 32 years old 20 days ago.
No, everybody does. April, I would say 8 months ago. Happy belated birthday to you too.
so much. And previously, I'm a full-time housewife and a mother. Mother of three.
Mother of 3. Wow. So please tell me how old are your kids?
My kids, the eldest one is primary 5, 11 years old, and the second is primary 2, the third is 3 years old.
I see.
Yeah.
Okay. But you were a housewife before.
Yeah, for the
Why?
past 11 years.
Come again?
For the past 11 years.
11 years. So why now you want to become a cabin crew?
I have actually, I thought about my future because I cannot depend on my husband. So because my husband's job is also one of the dangerous job as well. So I look forward touch wood if something happened to him. So who going to feed the children in the future?
Okay.
So if I have my own job, it's a backup.
I see. Good for you. Thank you. I like your grooming by the way. Please maintain. You're welcome. Come. Thanks.
Good morning everyone. My name is
Good
Juliana.
morning.
My name is Mohammad Sharul Nizam. You can call me Sharul. I'm 27 years old this year from Kota Kinabalu, Sabah. I have 4 years experience in hotel industry. Previously, I worked as a front office supervisor for 3 years. And I want to use all the experience during my time as a cabin crew.
Okay. But why suddenly now you want to become cabin crew?
Because before this, I don't have any experience in terms of customer service. My communication skill is not that good. So I took my time to find experiences in customer service. In fact, after I finished my study, I worked as a sales assistant at Cotton Sugar Sabah Shopping Mall for 2 years plus. And then I moved to hotel industry to be part of more professional field, which is hotel industry, before I prepare myself to become a cabin crew. I always wanted to become a cabin crew after I realized engineering is not for me. Because I studied engineering for diploma for 3 years. So then I realized I wanted to become a cabin crew.
Good for you. Very good preparation, huh?
Thank you.
Thank you, Cheryl.
My name is Ilham. Ilham. So
Ilham.
Yeah, you call me Am number one.
Okay.
And I'm 30 this year. I'm from Tawang.
Tawang?
Previously, I worked as a senior technical advisor in Bangkok, Thailand.
Bangkok, Thailand. Wow.
For one of our gadget company. So after that, they reduced the headcount there. So that's why I need to move to Malaysia back, and I tried to apply in Malaysia. And I got it actually. I got it, and then it's almost there. So I'm proud of myself. I tried this because it's very last minute. I tried this interview.
So have you ever thought that you're going to become a cabin crew one day?
Yes, actually, I tried on 2014, usually PKI. I passed, but I didn't pass the medical checkup.
Oh, really? What happened then? If you don't mind me asking.
What happened then, I could, because during that time, I still studying for STDM.
Oh, I see.
Then I moved on to work as a customer service for Shopee, and then for Accenture, and then gone to Thailand, and then come here.
So you have a few experiences, working experiences, very good. Okay, thank you.
Hello, good morning everyone, and my name is Alika. You can call me Alika. I'm 25 years old, and before this, I just finished my study degree in sport management, and I just finished also my internship at Extro Malaysia as Extro Airline Department.
I see. Why cabin crew then?
Why cabin crew? Before this, it's my dream at primary school. But then I have an issue with my family because my family just very bitter. So yeah.
Okay.
Here I am. Trying new things.
I see. Okay, good for you. Thank you, Alina.
Hi, good morning everyone. My name is Risha. You can call me Risha. I'm from Ipoh, Perak. I'm 23 this year. Before this, I worked as a waitress and cyberware.
Okay. Why cabin crew?
Cabin crew. Because before this was my dream, and I want to come out from the typical Indian house that is in a family. The girl have to become a doctor or a teacher.
A doctor or?
Doctor or teacher.
Doctor or teacher? Doctor or teacher? Oh,
So
you mean to say that's the culture?
Yeah, that's the house.
Okay,
So I want to set it up.
I see. So how about your parents? How do they take it?
My dad don't support me for me coming here. My mom does. So big argument going on till now.
Oh, really? You just prove them that you can do this, right? Thank you, Nisha.
Good morning everyone.
Good morning.
Yeah, my name is Seri, and I'm 25 years old this year. I'm from Malacca. So for my previous job, I worked in inside school as a shop manager for the past 7 years.
Inside school lah.
Yes,
I
in
see.
Malacca. Yeah, in Malacca. So actually sometimes I also work in air also. So it's like flexible. So why I want to become a cabin crew? It's like my passion.
Yes.
So actually I went to the interview like 2017.
Okay.
So I got it for party, but I didn't go for it. Yeah, because my previous company provided me a very high salary. So which is I feel more comfortable lah. So but after 7 years, I feel like there's a minute there for me to learn new thing. So I decided to jump up from my comfort zone and then I explore new things.
Okay. So it has been your dream and your passion. So now this is the
That's
time.
everyone's dream and passion.
Of course. Okay.
Thank you.
Thank you, Lloyd. Come, next.
Morning everyone.
Morning,
Australia.
good
My
morning.
name is Yasin. You can call me Anya. I'm from Kuching, Sarawak. I used to work for Maybank Private Banking before. Then after that, I joined Asia. I was an ex before for 7 years.
Okay.
So yeah, right now I rejoined.
Okay, what happened to you, I mean, when you were in Asia, right? You resigned?
Yeah, because I need to continue my studies and a lot of practical classes.
I see. So what did you do?
I took 3 courses, 4 certificates.
4
including
certificates.
SKM. Yeah.
Oh, okay, that's good.
Yeah. This is like an auto shop inside actually.
Oh, good for you, good for you.
Thank you.
So now you want to join back. You're here.
Yes.
Why are you still in Asia? Why don't you try any other
I
airlines?
prefer my own country. Like, I feel more home.
I see. Okay, good for you. Thank you.
Thank you, Mr.
Welcome back.
Thank you.
Good morning, everyone. Good morning, Julia.
Good morning.
My name is Muhammad Ilham bin Hasanuddin. You can call me number 2.
I'm number 2. That one number 1 lah. Why? Because he's more senior than
More
you.
than
In a way that you're younger lah.
Before this, I worked under Malaysia and I as a customer service officer department city. I'm 23 years old and I live with my family and Sabah, Kuala Lumpur.
Oh, okay, near lah. About what, 15, 20 minutes from here? 15 minutes. Okay. So you were in customer service, right? Malaysia Airlines. Can you please share with us your experience when you were in that department? Any good experience and any bad experience that you had?
I have a bad experience
Okay,
during a delay flight.
okay.
All of the passenger 170 comes to me. I'm the only one need to contact them, need to give them the hotel voucher and transportation.
How did you deal with it?
I call the abstract to help me. because-
Abstract?
Yeah,
Wow.
because it's very, you know what, pressure time.
Of course. So everybody was like barking at you lah.
Very, was bark at me.
So,
But I handle it smooth. I handle it smooth.
okay, alright. Thank you. Number 2. Yeah.
Okay, good morning everyone, and good morning Ms.
Good
Julia.
morning.
So my name is Raj, you can address me as Raj. I'm 26 years old this year. I'm from Johor. Right now I'm staying as a partner at Seri.
Okay.
So I have worked for 2 years at Changi Airport before as a aviation screening officer. After that I got promoted to be the SC opportunity. And after that, my mom was raised by SC officer for when last time I was working over there, I have interest on cabin crew. Whenever once you enter aviation, you cannot move out from aviation.
Exactly, I agree. Okay.
So actually, I had called back to join that, but I plan to go for different sector because that one is sorry, almost blank. Sorry.
It's alright.
Like stress up, a bit stress.
Oh.
I go for
Asia. Why Asia?
why Asia? Actually, for money because Asia with for airlines.
Okay, good. Thank you, Raj. Come next.
Hi, good morning everyone. I'm Vignesh. You all can call me Vignesh or Vig.
Hi, Vignesh.
Hi, bro. I'm 26 years old and I'm from Banting. Take 30 minutes from me.
Okay.
And my previous job, I was a farmer before this.
Farmer? Serious? Wow. Where is it?
Pulau Gede.
Really?
I work with my dad.
Farm. So what do you actually plant?
He plant oil palm and
Oh, really?
yeah.
Oh, it's not easy to get youngsters to do all this, you know. I'm impressed. So why suddenly now you want to become cabin crew?
Actually, the first time I traveled, I saw them and I got a little bit inspired. And
You saw them?
I saw the cabin crew.
Okay. So what when you see them, right? What do you think? What the first thing on your mind?
First thing, sunset.
Oh, cantik ah. So you want to be like the cantik one?
The second thing, they confident.
They look confident. So you want to be like that. Okay. What else? Besides the look, you're confident.
Maybe I just want to travel
Oh, okay. Because you want to travel.
something.
I see. Okay. So how did your parents take it? Because before this you helped them, right? So what did they say about it?
My father is kind of open-minded person.
Okay, very good.
Whenever I try something new, he will support it. Yeah.
Thank you, Vignesh. Next. Salam.
Good morning, Miss.
Good morning.
My name is Mohammed Iqbal, 23. I am 25 years old. For this, I stay in Nepal.
You stay in Nampang?
Now I rent here.
In Nilai. Okay.
So, my previous job, I was doing I am a taxi driver.
Taxi driver. Oh. So which area you cover most of the time?
Sometimes Nepal.
Sometimes airport. So when you bring all these people, do you encounter anyone that is kind of weird or whatever?
Yeah.
Okay,
So, drunk.
Come again?
Drunk person.
Drunk person. So how do you handle that?
How I do.
You don't do anything. You only drive.
I just drive.
I see. Okay.
When I arrive the location, so I wake up her.
Yeah. Okay, I see. Alright. So then, why did you choose to become cabin crew?
I'm not sure.
You're not sure, again you're here.
I'm looking for something new.
You're looking for something new. Yeah, there's a lot of something new up there. Why cabin crew?
New culture.
New environment and new culture. So what kind of culture that you know here that we have for cabin crew?
You have to be. I have to be.
You have to be firm. Okay, good. Yes.
Grooming,
Grooming. Good grooming.
communication,
Good communication.
teamwork.
Wow. Okay, good, good, good. Do you have any friends or family members that are cabin crew? A lot. No wonder. So you're inspired by them?
Yes.
I see. Okay. Thank you for sharing. Goodbye.
My name is Juliana.
Good morning.
Everyone. My name is Seri. I'm showing. You can call me Derek.
Okay.
I'm 21 this year from Kuching Sarawak. Before this, I was in HX.
Oh, okay.
Then COVID happened, so I got retrenched. Then I went for my diploma. And now I'm back here. Why Asia? I don't think it's because of the flying, it's more towards the people and culture that make me miss flying.
I see. So diploma, right? You took major in
Business and finance.
business and finance. Why do you take the diploma?
Actually, I always wanted to experience college life.
College life.
Sorry for it.
I see. So how was it?
It was stressful because of the assignment, but I made it.
I see.
Yeah.
Congratulations.
Yeah, thank you.
So, well, how long were you with AirAsia X?
I was in the HX for 6 years.
6 years, huh? So you miss flying?
I don't really miss flying now, I just miss the people and the culture.
Oh,
Because
the
working
people.
outside is actually very stressful. The hierarchies and everything is different. But it's not the same in Asia.
I see. Why don't you apply for AirAsia X then?
We'll see how it goes.
I see. We have opening almost again next month. Okay, anyway, welcome back. And thank you. Last but not least.
Hello, good morning, Ms. Julia.
Good morning.
Everyone. Nice meeting all of you. My name is Jeremy. I am 24. Previously, I worked as a cabin crew in Maswings. I'm from Sabah.
Muslim for how long?
12 years.
12 years. Then what happened after that?
I came here.
So from Muslim, you choose to be here.
Yes.
Why AirAsia?
Actually, I've tried other airlines before, but I didn't get it. So I put a mindset to myself, okay, why not just stay in Maswings for a few more years? And then I become ICC, okay, there's a promotion. And after that, I feel like there's a burnout in my phase of life. I feel like I want more. So I tried NMB, I didn't get it also.
Okay.
That was when I was 28.
Mm-hmm.
So I was like, okay, maybe I'm going to retire here lah.
Okay.
And then Ebola is about to come in. So there's lots of fear mongering, rumors.
Yeah,
There's
yes.
also excitement.
Exactly.
I'm also excited for that. But I tell myself, because I'm 34, right? Usually most of the airlines maximum age is 35.
Yes.
Even Batik Air also for the male crew 28 only.
Mm-hmm.
So I tell myself, okay, I give it one last shot. If I get it, then maybe this is the right time in my life. If I don't get it, maybe I'm going to stay with the formula. So I got it. I resigned. So I came here.
So,
Yeah.
good for you.
Yeah.
Congratulations that
Thank
you're
you.
here. Thank you so much, Jeremy.
Thank you.
Okay, thank you everyone for the introduction. By the way, my name is Juliana Dewi, or you can call me Miss Julia, as I mentioned this morning. I stay here in Bandar instead, okay, only about 10 minutes away. And after I have finished my SPM, I joined Citibank, Jalan Ampang, working in telemarketing department. So on that 26th floor, I was the only Malay, and the rest are all Chinese. And knowing Chinese, they're really good in doing sales. But me, it is not my field at all. So I survived only 3 months there. I cannot take it because every morning my manager will call me from her desk. So Juliana, berapa ribu sudah ni hari? I said belum lagi. Hanya, tak boleh lah ini macam. So there is actually one big whiteboard in our office, you know. They wrote all the telemarketers' name. So my name always on the bottom list. I make maximum 3,000 in a day. The rest of the telemarketers, they make at least 30,000 in a day. So it was really stressful. Every day I go back from work, I'll be crying. Every time I want to go to work also I cry. So I said, that's it lah. So after that, I moved to Isetan KLCC into their accounting department as account assistant. So I was there for almost a year. It was really actually enjoyable experience because working with Japan company, there is no such thing as power distance. My clerk is there, my accountant is there, my manager is there, my CEO also at the same place. So they don't have any power distance there. But then one of the day, one of my friends actually asked me to join her to go for interview. So which I did. I went with her. We went for the interview in Malaysia Airlines Academy in Kelana Jaya. So yeah, luckily I got it. So I joined Malaysia Airlines in 2003 as a cabin crew, and I was only there for 12 years, and I resigned because I really was young. And then I was at home for about 4 years, like that, raising my kids, and then I feel like, okay, it's time for me to work again. And like people always say, once you're cabin crew, you always want to be a cabin crew. So I tried. 2018, I joined Malaysia Airlines back again, but under Amal. Have you heard of Amal before?
Yes.
Amal is actually another subsidiary under Malaysia Airlines. We only do flights to Jeddah and Madinah, and we have a different type of uniform. We wore pants and long jacket with hijab. So I did that only for a year, and then pandemic hits, so we did not renew our contract. There's no flights. And after COVID, I then joined one of the academy in Mantin, offering certificates for those who want to become cabin crew. So I was there for a few months. Then one of my friends said, hey, why don't you try CAE? So then I came here and I got the chance to be here. So far, I'm so happy to be here. I'm teaching first aid, grooming, and also in-flight services. So that's it. It's a totally different culture, I would say. But of course, different companies, they have their pros and cons. Okay, my previous company was very good. Here, it's totally different culture, but I can adapt to it. And so far, I really love my job here. Okay, any questions? Everyone? No? All right, thank you. So before we start with first aid, I would like to Let's just revise regarding the safety in this building. You all still remember?
Yes.
Yes.
Yes and no. You all see clearly?
Yes.
So we are in CE now. How long have you all been here? Almost 2 months. So I'm sure you're already familiar with the building, but yet we still need to do a refresher. Okay? So now, let's say anything were to happen, that if there's any fire. Do you notice we have the DCF outside at the aisle? Do you know how to use it?
Yes.
So you have done the safety class. Okay? So if you know how to use it, it's good. So how to use it, you have to use this pass method. Pull the locking pin here and aim at the base of fire, and then you need to squeeze the handle, this one, and need to fight the fire with sweeping motion, okay? And then next we have external and internal threat. External threat means anything happen outside the building. For example, all this severe weather, gas leak, external fire, and also chemical spill and all this. So, I'm not sure whether you're aware, but last year we actually experienced a gas leak in front here. I was in the building. I was actually doing first aid assessment in Makassar room. And it was actually 5 of us in the room. Suddenly we smells like durian, you know. Seriously, durian. So I thought like, hey, somebody ate durian. And my trainee was performing CPR, look at me. Like that. So I'm like, hey, what is it? So, and a few seconds later, we heard announcement. So as I opened up the door from Makassar room, the durian smell was very bad. Everybody thought it's a durian, but actually it's a gas leak. Okay? So at that time, we heard the announcement, they asked us to evacuate, so we did, we evacuated and go to the assembly point. But a few moments later, we will redirect to go inside the building back again, because when we go outside, the smell was really strong. So we have to stay inside. And then a few minutes after that, they said everybody needs to go back home. Because after that, one or two of the instructors were actually complaining of difficulty in breathing, and a few of the trainees were actually vomited and all that. So when you have any incident, okay, you have to listen to the announcement that has been made, whether or not you have to stay in the building or you need to evacuate. Okay. Internal threat. If let's say you see any fire, what must you do? You need to break this glass. How can you break the glass? What do you use to break the glass?
Elbow.
Elbow. Oh, so strong, huh? The elbow. Besides elbow, what can you use to break the glass? The glass is very thick. Okay. Use like phone now. Who wants to use the phone just now? Really, you want to sacrifice your phone? You break using the phone. The glass did not break, but your phone break. What else can you use?
It's coming with a small hammer, right?
Not really.
The fire
No.
extinguisher.
Come again?
Fire extinguisher.
Use the fire extinguisher. Wow. Okay. Okay. What else? The most simple one that you can use.
Bottles.
Bottles.
Kick it.
Kick. Yeah, so high to kick.
Hi, what? Tell me what?
Wow, so flexible. So flexible.
Hey, I'm a...
She is one of the Fantastic Four lah. What's the name? The guy? Elastic man. Elastic woman.
Chinese martial arts. 7
Really? Very clear? Okay. Can you use pen?
Yes.
Can you use your shoes? Yes. Okay. And then it will trigger the alarm, and you need to listen for the announcement. If you think the fire, you cannot put off the fire, it's too big, what must you do? Run for your life. You need to evacuate. Okay, escape sign, exit sign. Okay. Next, we are in the, where are we now? Which classroom? Palembang. We are in the ground floor, correct? Yes. So where is Palembang? Here. So where is our nearest exit? Which number? Number 9. And this is what, this door? Number 10. Throughout the cafe, and here. Number 8. Okay. So you need to evacuate through this door. So after you evacuate through the door, where do you go?
Assembly point.
Assembly point. Where is your assembly point? Kapang B. Here. So let's say, for example, you evacuate through the cafeteria here, right? So where do you go? To the right or to the left?
Left.
To the left, and then to the car park B. So once you arrive at the car park B, what must you do?
Do a head count.
Head count. Who will do the head count? Very good. Who? Class monitor. Who is the class monitor? If Tanya is not there, anybody can do the head count. How many you should have?
16.
Don't forget about me. Okay? You should have 16. Okay. Now, if let's say you counted there's only 12, what do you do next? Report to whom? Go and find. Just now you say find? You don't become Captain America. Huh? Come back here and go and find your friend. Okay, you also rentung. Okay, so you need to report to whom? Instructor. Instructor not there? Security. Security coordinator or any of the bomber. Bomber will, the abang sadar from the bomber, they will come over and look for me. Okay? Alright. Done. Next, okay, this is your assembly point. Thank you. That's it. Okay? So whenever you take the steps, what must you do? Oh, run. Wow, run.
Make sure you hold the stairs firmly.
Okay, thank you. Make sure you hold the handrail. Can you walk with while texting? No. Okay, no. Put aside. How long does it take for you to go from down here up there? 1 or 2 minutes, 10 minutes. So long, what do you do? That's the thing. Don't use your phone when you take the stairs. Okay? Any questions regarding the safety of the building? All of us good? Yes. Thank you. Okay. Class, blood-borne pathogen. Okay, what is blood? Ayo, of course I know darah.
Liquid that flows in our body.
Come again?
Liquid that flows in our body.
Okay, good. Your body fluid.
Body fluid.
Okay? Born means transfer. Pathogens means virus or bacteria.
Miss the transfer over.
Oh, ya. Oh, dia cek aku supaya ngomong. Baik, cikgu. Thank you. Okay, so blood-borne pathogen means virus and bacteria that transfer through body fluid. Okay, so now the most common ones we'll see is the hepatitis B virus, or HPV, or HIV. So this is very common in Malaysia, right? Yes. Alright. So now it can happen when there is blood transmitted of the infected person through body fluid. It could be from your blood, vomit, semen. What is semen? Sperm. And also vaginal secretion. What is vaginal secretion?
The
Secretion from.
Is it?
The discharge. Fluid from woman. Sperm from men. Okay? So now, hepatitis B virus, hepati in Latin actually means liver. Itis means inflammation. When there is infection, the liver will have inflammation. Okay? So causes are by all these exposure to toxics, drugs, and also the entry of the virus through the bloodstream, and of course excessive use of alcohol. How can it be transmitted? Through contact with body fluid. For example, unprotected sexual activity. So what do you need to use when you have sexual activity? Use protection. Where can you get it? Everywhere now. Easiest is 7-Eleven. At the counter. No need to go and search. Okay? And then through injection. See in the movie they take the needle, they inject themselves, and then the needle they share to the rest of the friends. Okay? And then needle prick injury. What does it mean? Meaning to say you walk at the back alley, you wear the very thin flip-flops, and there's a needle there, and you accidentally step on the needle. Then
They say normally they give this in the cinema.
Cinema?
The seat pen.
Really?
Yeah, last time.
Serious?
Not tetanus, right? Not tetanus.
Tetanus? So you have to be very careful lah.
Very, very important.
Okay, so needle prick injury, and also from a mother to newborn baby, the baby in the stomach. Okay. Silent symptom, you will have all these: fatigue, nausea, vomiting, aching in the muscle and joints. The person will have a loss of appetite, all these, fever and jaundice. Remember just now the skin color? Jaundice due to liver problem. Hepatitis B, inflammation of the liver. So obviously the person will have jaundice. Okay. So is there any treatment? Pre-exposure, meaning to say before you get it, or maybe acts of prevention. Okay. So you avoid unprotected sexual activity. When you have someone, you think of something to do, better think of 7-Eleven. Go and get protection. Okay? Avoid sexual multiple partners. Why? What's wrong with him? Kenapa Iqbal?
Expert in the biology.
Okay, avoid sexual with multiple partners. So let's say today I feel like having nasi lemak, so I go find a Malay guy. Tomorrow I feel like having chiu chong fan lah. Go and find direct. After I feel like having kimchi lah. You see back to 1, 2. Okay? Whatever it is, you have to have protection. Okay? And then to avoid using of IV drug, intravenous drug. And then observe the use of precaution, correct use of barrier protection and disinfection. Always wash your hands, always just wash your body. And then you can get vaccination for hepatitis B. Okay? This is pre-exposure. Post-exposure, meaning to say, let's say on that flight, you already rendered first aid to the casualty, and after a few days suddenly you receive a call, actually the casualty has HPV. So maybe you can get infected. Who knows, maybe you get paper cup that you get paper cup that you did not realize, and so happen you go and pegang the person, they have blood there. So the blood of the casualty goes into your bloodstream, you can have whatever disease the person has as well. Okay? So post-exposure, you can have and get your vaccination, but within 24 hours of exposure. Meaning to say, after you go back from the flight, straight away go and get the vaccination. Okay? Post-exposure anaphylaxis. Okay, that is for hepatitis B. Okay, next let's have a look into HIV. HIV stands for?
Immunodeficiency virus.
Yes, okay, that will weaken the body system. Causes are actually the same like HPV. Unprotected sexual activity, sharing of the needles, sexual contact with the infected person, blood transfusion. So very dangerous these days. If you want to go for blood transfusion, make sure they have got a certificate or they are really legal. Okay? And then infected mother to an unborn child. This one very sad And all of these are the signs and symptoms. The person will have recurrent fever. What does it mean by recurrent fever? Keep coming back, correct. Let's say I have a fever today on and off. And then tomorrow, okay, subside. The next day I'll get it again. Okay, so that is recurrent fever. Persistent diarrhea, weight loss, and unexplained bruising and bleeding. Like us, we have to like fell down and have the wound and then only we have the bleeding, right? But for HIV person, sometimes they don't hit anything, but suddenly there is bleeding. Because why? The system of the body is really failed. Okay? Now, average length of time to process into full-blown AIDS. From HIV, unfortunately, the person will have AIDS as well. So it's going to be about plus minus 8 years. Not necessarily the person will get AIDS within 8 years, maybe take longer time or maybe lesser time. But average will be 8 years. Okay? So these are the signs and symptoms: herpes, pneumonia, and the person will have gastrointestinal problem, tuberculosis, fungal infection, sore throat, and or white spots in the mouth, and also lymphomas. Same thing, there is only exposure prevention. All of the prevention is just like your HPV. Avoid unprotected sexual activity, avoid sexual activity with multiple partners, avoid using of IV drugs, observe university precautions, and also correct use of barrier protection. If you notice, HIV and HPV all are almost the same, correct? But for the pre-exposure, there's only one difference between HPV and HIV. What is it?
Vaccination.
Very good. Vaccination. HPV, they got vaccination, but not for HIV. Okay? All good? Next, airborne pathogens. Virus transfer through air. So what is the common one that we know? COVID. Influenza. TB. Okay? Good. Alright. So let's talk about TB. Tuberculosis. Causes by bacteria. These are all signs and symptoms. The person will experience tiredness, weight loss, general malaise. Do you know what is general malaise? You know when you want to have fever, not when you get fever, on the first half of the fever, you have like something you feel like uneasy. I don't feel like having anything. If I want to sleep also, I don't feel good. All of this feeling, that is general malaise. Fever, cough, night sweat, and sputum traces with blood. What is sputum?
Mucus from the throat.
Phlegm. The phlegm comes with blood. Okay? So, the treatment, you are not going to do this. This is information for you. Okay? Doctor will x-ray the lung and take the sputum sample through broncho biopsy, and then that's it. They will do all this. Okay, take the sample. Okay. Next is meningitis. Inflammation of the membranes enclosing the brain and spinal cord. What is spinal cord? Your backbone. Our head is connected to the neck and connected to the spinal cord, to the backbone. So causes are by bacteria and happens most of the time to the kids, to the child under 5 years old. Why is that? Why?
Why when they were young they didn't have that vaccine, right?
Come again?
When they were young they didn't have that special vaccine to avoid meningitis.
Okay, acceptable.
The immune system is not fully developed yet.
Immune system, good. Exposed to outside. So kids normally at this age, they are exploring. So they love to take and put it in their mouth. Anything they just put in the mouth. Okay. So all this bacteria will build up. All right. Can also lead to death and brain damage. It's very severe, meningitis. So sign and symptom. What is irritability?
Angry. Easy to get angry.
Very good. Easy to get angry, bad-tempered, show tantrum. Okay. And have fever, vomiting, neck ache and often rub the ears, drowsiness and coma into tonic and clonic phase. Treatment. Doctor will perform lumbar puncture for viral hepatitis, will inject the antibiotics, and also the improvement is apparent within 36 hours. Have you seen people take epidural before? Something like that here.
That's for Caesar. Caesarean
Okay, you will inject here at the spinal cord. Now, precaution of airborne pathogens. Wash your hands and any exposed skin with soap and water for 30 seconds. Now, I want to share something with you regarding wash hands with soap and water. When I was flying before, this one steward, he was bedridden for a year. So after a year, he came back flying, so he actually will share his experience to the rest of the cabin crew. What happened to him was, one day, he got a very severe stomach pain until he cannot walk. So they transported him to the hospital, and when the doctor checked, the doctor said there's too many bacteria built up in his intestine. So basically, they had to cut his intestine. But then they did not know what caused this. So the steward was in the hospital for 3 months. After that, discharged at home, bedridden. So after a few, checks and investigation and experiment and all this, they got to find out that the habit of the crew, the male crew, actually contribute to the bacteria built up in the stomach. What he did was, when he was flying, after service, you're going to have your meal, right? So when you want to have your meal at that time, passenger will be queuing to the toilet. So basically, you do not have time to go and wash your hand properly in the toilet. So what he did, he just washed his hand in the galley with water at the sink. And then he take gloves, the plastic gloves, and he will eat with the glove, hoping that it is clean. Of course, it is clean glove, but little that we know that this glove, it comes in a plastic bag. So everybody will go and get it. Sometimes crew will take it, wash toilet, and they need extra. The one that they have used now, they go and take the clean ones from the plastic. So of course the bacteria is there already. Okay, so the steward so-called think that it is clean, take the glove, use it and eat. Every day throughout his career. Until that day he cannot wake up, severe stomach pain, then only the doctor said because there's too many bacteria built up in the intestine.
Miss Julia, how old is this guy?
Oh, I can't remember how consider young. Sorry, that time I remember we did 737 flight, so you must be still young at that time. So what I'm trying to say is always wash with soap and water. And use a clean utensil. Okay? But when you're working, sometimes you are, because you don't really have much time. So don't risk yourself, no matter how short the time is, but don't risk yourself. After that incident, after he shared with everyone, so what we did was we always take the soap, 1 bottle of soap, we put next to in our galley next to the sink, so we can always wash. But then, sad to say, 320, your sink is very small. You can't afford to go and wash your hands there. You have to go to the toilet. Wash your hands properly. Okay? Right. Now, next, use protective barrier to protect skin, protect the body fluid. Example, gloves. Okay? And then, whatever that you have used when you render first aid, you have to take it out and make sure you clean yourself before you resume your duty. Okay? Because remember, you're not going to render first aid until landing. You still have your duties to do. So, whatever gloves that you use, throw properly and wash your hands. Okay? Next, other pathogens, hepatitis A. Just now we have a look into hepatitis B. Hepatitis B, something to do with body fluid. Okay? Hepatitis E, something to do with the food and drinks that you take. Okay? Now, caused by virus that normally lives in the gut, infection is spread through from person to a person, and causes are by contaminated food and drink. Right? Sign and symptom, it will take 2 to 6 weeks incubation. Meaning to say, let's say today I ate a food that is already contaminated. I will not get the sign and symptom today. I'll get it between 2 to 6 weeks. Okay? And the onset is gradual, whereby it's like a flu-like symptom. And then you lose of appetite, and then nausea, vomiting, pain in the abdomen, and also jaundice. Remember, hepatitis, liver. Okay? Pale stool. What is pale stool?
Light color stool. Light color feces.
Yes.
Light gray, like that.
No. Light grey, yeah. God, light grey. Have you seen light grey? Have you seen baby's poop?
Yes. Green color.
Green,
Yellow.
green or yellow. Like turmeric color, isn't it? Something like that. And then itches all over the body. So, what is the treatment? To rest during the jaundice period, and then to avoid alcohol for a year. Why alcohol? Why?
Because the liver malfunction.
Exactly. Okay. The alcohol substance is very strong. It will damage the liver more. Okay. So you have to avoid alcohol for a year. So prevention for hepatitis B, A. If you go to any countries that you think the cases of hepatitis B is very high, better get yourself injection before you go into that country. Alright? Chickenpox. Anybody never ever experienced chickenpox before? Wah, serious ah?
Good luck, super itchy. Got vaccine already with that.
Yes.
I kena chickenpox and measles.
Oh yo.
1 year after 1 year.
Not unusually box and chicken.
What?
Okay, for those of you that had chickenpox before, what do you experience at that time? Fever, itchiness.
I feel so itchy.
Itchy.
I got it at my 20.
I got it when I was 15.
So young. What else? What is that? Right.
你看我这个中间疤痕出来，我来疤。
What is it called? Huh?
我黑黑的，我拿来吃。
Come again?
我出好像是给我疤那个我
What is that?
这边啊，大腿白白啊，滴滴啊。
Blister.
So I do like that.
Okay? Blister. Alright. So you have rashes all over the body, fever. blisters and itchy. Can be transmitted via direct contact with the infected person. One person got chicken pox comes into this room. Thank you very much. You get it for free. Okay. Now, incubation period 14 to 16 days. Okay. So you cannot fly within this 14 to 16 days if you have chicken pox. Okay. Because if you go inside the aircraft, the whole aircraft will get it. Alright. Next, what is disorder of circulation? What is circulation? Come again? Very good. Blood circulation. Disorder? Abnormal. Very good. Okay? So blood circulation is not normal. What happened? Fainting. What is fainting? I can translate also lah. Loss of consciousness due to reduction of blood to the brain. Okay. Brief loss of consciousness caused by temporary reduction of blood to the brain. Causes are by nervous reaction to pain and fright. Sometimes, if let's say you see motor vehicle accident, very bad one, the person becomes unconscious or faint, okay, because of the pain or fright. Number 2, exhaustion, extreme tiredness, too tired, I'm working non-stop, at one time my body cannot take it, I faint. Alright? Number 3, emotional damage. Okay? Remember what happened during COVID?
Yeah.
People are all jobless. Exactly. We heard a lot of cases of people commit suicide. Because why? They have commitments, they have family, and suddenly they have no job, cannot pay everything, whatever, they just commit suicide. That is considered emotional upset. Number 4, sudden change in posture. Have you ever experienced, let's say you are squatting down for half an hour doing gardening under the hot sun, and then suddenly your phone ringing. You need to get up immediately and take your phone. What happens when you get up? What do you feel? You feel dizzy. Somehow you feel like there is ringing in your ears. Correct or not? You try to grab on something to sit down, isn't it? Okay. It can cause fainting. So sign and symptom: pale face, nausea, air hunger or yawning, unsteadiness, meaning that cannot walk properly, and cold sweat. Treatment: there will be 2 types of fainting. Fainting on the seat and fainting on the floor. Okay. Treatment: number 1, check Dr. Cap. DRCABD. What is it? I will explain to you later. Okay. Now, number 2, loosen tight clothing and reassure. It's okay, I'm with you. And then lean forward, head towards the knee for 30 seconds. Okay. Come. Derek. You are my favorite. Okay. So check Dr. Cap. I'll explain to you. And then loosen tight clothing and reassure. Don't worry, I'm with you. Okay. And then, sir, I need you to lean forward, head towards the knee for 30 seconds. Okay, count. 30 seconds.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, sir. difference in this color of the face and the ears?
Yeah.
What color now?
Red.
Red. Okay, what does it mean?
Oxygen flow.
Oh, dia cakap. Okay, very good. Okay, so meaning that he's not fainting anymore, now he can speak. Okay, because you want to promote the blood flow to the brain. Okay, thank you. Okay, next. If it's a pregnant lady or obese person, can you ask the person to lean forward? Seberanak mother. Okay, so what you need to do, you ask them to do a raised position, whereby just like this, put the hands in the on the seat in front of the person and head towards the hand lah. Okay, for 30 seconds as well. Alright. And then upper air vent. What is air vent? And then fan with newspaper or magazines. Apply cold towel on the forehead. Okay, that is fainting on the seat. Next, let's have a look fainted on the floor. Same thing. Check out the cap. Give oxygen if necessary. And then raise the leg and loosen tight clothing. Now this one who previously asked me, Mace, how high do we raise the leg? 45 degree? 30 degree? Wow. 90 degree? Ayo. Say 90 degree. Who? Say 90 degree?
Different motive already. He want different treatment.
It's the wrong lah. 90 degree lah. But as well you say, as depending on how short is the skirt. Not so high. As long as above the heart level. See? As long as above the heart level.
Miss, can you use drawer with that?
Come again?
Use drawer with that.
Drawer? Your service drawer lah. Can, but don't you think so it's gonna hurt the casualties later?
Use the tissue lah, paper hand towel.
Dia main towel lah.
SU.
Pillow ah. SU. My God.
Use the back.
What do you think you're gonna use here?
Trolley back.
What trolley?
D7 we use the pillow lah.
Hello.
AK.
AK, welcome to Russia.
Package bag.
Luggage bag.
Ah?
Our luggage bag.
Bags lah. You use drawer or SU, even worse lah. Okay? You try to use something that can, make the casualty feels comfortable. Okay? Next, apply cold towel on the forehead. Monitor and reassure. Do not stand the casualty until the person is fully recovered. Because if let's say they are just halfway only, if you force him to stand up, after that they fall again. What's the point? Okay. If conscious, treat management of unconsciousness. I will explain to you. And then next is shock. Excuse me. So if you notice the treatment for fainting on the floor, fainted on the floor and fainting on the seat, almost the same. The only difference is
Moving forward 30 seconds.
very good the position. If let's say fainting on the seat, lean forward. On the floor, raise the leg. Okay. Right, let's have a look into fainting. Into shock. What is shock? It's a state of collapse due to a lot of blood. This is very serious because it can result in death. Okay. Causes are by severe bleeding, reduced body fluid, okay, and allergic reaction. The sign and symptom will be pale face, sweating profusely, okay, and cold clammy hands. Breathing is shallow and fast. The person will shiver, and in severe shock, the person may collapse and become unconscious. Treatment of the cap. You administer oxygen, loosen tight clothing, position casualty, raise the leg, and then keep warm by covering with blanket and jacket. Do not give anything by mouth. Now, this treatment is similar to fainting on the floor. The only difference is for shock, you cover with blanket because the person is shivering, is cold. Very good. Okay? Monitor vital sign. Take note of the vital sign. What are the vital signs? Breathing, pulse, skin color, and level of consciousness. Okay? If you put a person into recovery position, every 5 minutes you have to check for vital signs. So you have to know what are you checking. Check vital sign, but you go there, you don't know what to check. Okay? Breathing, pulse, skin color, and level of consciousness. Next is unconscious. What is unconscious again? Not awake. Very good. Not awake. Unconsciousness is a result of an interference of the brain with normal activities. Causes are by fainting, head injury, lost a lot of blood, and then when the person is having stroke. Okay. Food poisoning. What is epilepsy?
It's
Jerit.
Fits.
It's a fix. It's a seizure. Okay. Yes. Anything you want to share about that?
Vital sign tadi what's it? Vital sign.
Vital signs. Breathing, pulse, skin color, and level of consciousness.
And the shock is similar to fainting.
The treatment. Fainting on the floor. But the only difference is
Cover with blanket.
covered with blanket. Okay? So after this you have to know. Okay, sign and symptom very similar. So how are you going to differentiate? Look at the differences. The differences, yes. Now, unconsciousness again. Sign and symptom, no response to question or attempt to awaken and unable to maintain or airway. Now, when the passenger collapses, you need to go and check for response. When you check, sir, are you okay? Are you alright? Suddenly he wakes up. What happened? I think I fell asleep just now. So do you need to do anything? No, lah. Well, you ask him to go to his seat. Okay? But when you go and check, sir, are you okay? Are you alright? No response. Meaning that the person is unconscious. Okay. Treatment. Lay the casualty flat on the floor. Check. Drop the cap and carry external physical examination from head to toe. Now, collapse already. Make sure the casualty facing up. Okay. Maybe the casualty when collapse goes like this. Correct or not?
Yes.
Not necessarily terlentang ni. So now you make sure he's facing up. Okay. And then you do body examine. Make sure if there's any part of the body has injuries. Okay. And then if the person is breathing, place into recovery position and administer oxygen. What is recovery position? We'll cover later. Okay. Next is life-saving techniques. So far, all good?
Yes.
Okay. Give me 1 minute to drink. Okay, my voice is getting different now. You need 5 minutes for the break? Okay, hurry up, 5 minutes for the break. Come again?
Still recording.
Okay. Thank you. Okay, done. Okay, life-saving techniques. Now, let's talk about our circulatory system. Okay, we have 4 chambers of the heart. We have right heart and left heart. Right chamber, left chamber, and we have the right atrium and left atrium with the right ventricle and left ventricle. So, this is our arteries. Arteries carry blood away from the heart to distribute oxygen to the cell of the body. Okay, and then the veins will carry the blood towards the right heart and go to the lungs to get it purified. Why? When we breathe in, oxygen will rush into our lungs. So the blood, when it goes back to the lungs, it will get oxygenated. Okay? Alright. So now, coronary arteries. Coronary arteries are the arteries around the heart that actually pumps the heart. So if you see sometimes when a person have heart problem, meaning to say the coronary artery may be blocked. So it will not be able to pump the heart properly. Okay? Alright. CPR. Have you heard of the word CPR before?
Yes.
But do you know what is the full name of the CPR?
Cardiopulmonary resuscitation.
Cardiopulmonary resuscitation. What is cardio?
Heart.
Cardio is the heart. Pulmonary
Lungs.
is the lungs. Resuscitation means to revive. Okay? When the person is not breathing, something to do with the lungs. And there is no pulse, meaning meaning to say the heart stops to pump, cardio. So how to do it? You have to resuscitate or revive the heart and the lungs. How do you revive the heart? You give chest compression. Okay? How many chest compression? 30 chest compression. Followed by 2 ventilation, 4 lungs to revive the lungs. Okay? Resuscitate to revive or to awaken the heart and the lungs. Are we good so far?
Yes.
Okay. Next, crucial links of survival. Number 1 is to immediate recognition of cardiac arrest. Meaning to say, when a person collapses, you need to check for their respiration, pulse and breathing. Does the person has pulse? Does the person has breathing? If the person you check, no pulse, no breathing, meaning to say the person is having cardiac arrest. What is cardiac arrest? Heart stop to pump. Okay? Next, early CPR with emphasis on the chest compression. When you start CPR, you start off with chest compression. And then rapid defibrillation, which is your AED. When the AED comes, then you use the AED. And then effective advanced life support, you call for ambulance assistance and to transport to the hospital to get further treatment. Okay, post cardiac arrest care. Okay. Next, artificial ventilation in CPR. You're going to perform chest compression to revive the heart. When you're performing chest compression, meaning to say you are trying to awaken the heart. When you are giving 2 ventilation, meaning that you need to give oxygen to the lungs. So now, how do you give oxygen? We have 5 methods. Okay, number 1 will be mouth to mouth. Okay, meaning to say you need to cover the casualty mouth with your mouth. When you do it, you need to pinch the nose. Okay, let me grab this gauze. Now, I'm going to give mouth-to-mouth ventilation, and at the same time, I need to pinch the nose of the casualty. So I need to blow. Can you see it?
Yes.
Okay. So now, you already get so excited lah. The person collapsed just now was jongkok. You want to do your French kiss lah now. Suddenly you see there's so many blood coming up from the mouth. Are you going to do the French kiss?
No.
No. So now how are you going to give the artificial ventilation? You do mouth to nose. Close the mouth and you blow through the nose. Okay, that's another option. Mouth to mouth, mouth to nose. Next is to cover both nose and mouth. That one is for infant. You need to cover both the infant nose and mouth because the baby is just too small. Okay? Now, this is your baby. So you cover both the baby's nose and mouth with your nose. And you give puff of air from the cheek. For child and adult, you blow. For infant,
Puff of air from the cheeks.
okay?
Puff of air from the
Yeah, how do you do it? Direct. Okay, that's how you do it. Why can't you blow?
Gastric intention.
Gastric or the baby's lung is just too small. It may rupture the lungs of the infant. Okay, so you cover both nose and mouth of the infant, give puff of air from the cheek. Okay? Alright, the fourth one will be by using ambumas. Remember the ambumas this morning?
Yes.
This one. Can I use this on both, on all three?
Yes.
Adult, child and infant. Can I use the ambumas?
Yes.
But there's a difference, right?
Yes.
So what are the difference?
The nose for the infant facing to the mouth.
Nose of the infant
The
facing the
nose part,
mouth.
the nose part of the animals.
Good.
Yes.
For adult and child, you cover like this. But for infant, you turn it like this. Okay? When you're using ambumas. The last one is by using resuscitator. This is your resuscitator. But let me tell you, this resuscitator can only be used on adult and adult. Adult and adult only. And this is one time use, cannot use it again. Alright? So, no, you do not need to dispose, you put it back into storage, but you have to put it in your CCL. Once you arrive at your base, the engineer will come over and vacate and give you a use. Okay? So, remember, 5 methods of giving artificial ventilation: mouth to mouth, mouth to nose, mouth to mouth and nose with the puff of air from the cheeks, using ambumas and also resuscitator. Now, universal precaution: wear mask if it's available, wear disposable gloves, and ensure you have no ulcer or cuts in your mouth when performing mouth-to-mouth ventilation. Why is that?
Bacteria infection.
Bacteria infection. So if you have ulcer or cut in your mouth and you do mouth-to-mouth ventilation, whatever disease the casualty may has will transfer to you. Okay? So you have to know that if I have something, I better use the barrier device. Okay? Next, steps of Dr. Cap. Okay, just now you already cover, you see, check Dr. Cap, what is Dr. Cap? Okay? Dr. Cap is basically D for danger. Danger, what's about danger? Yes. When someone collapses on board, before you go and render first aid, you must make sure there is no danger to yourself. What are the possible danger that you may have? Fire. That yourself or you. What are the possible danger that you may have?
Bacteria.
Bacteria. I have bacteria and I cannot render it first aid. When you're donning your uniform on board, what are the danger that you may have?
Your pin.
Pin, very good. What else?
Heels. The heels.
Heels. You are not going to go and check.
That is
Kejap tangan.
Basic.
You. Lanyard. Watch. Sometimes ladies, they love to put pen here
Oh yes.
when they wear uniform, correct?
Between the compressed.
So imagine you do not remove your pen and you are doing compression. The pen will poke your chest. Okay, so you have to remove all that. So when you go to the casualty, make sure there is no danger on the casualty. What are the possible danger the casualty may have? Necklace. Okay, good. Remove it away. What else?
Earrings.
Earring, no need. Watch, no need. Because you're performing CPR in
The
this area.
wired bra.
Wired bra, not so.
The jacket.
Take off the jacket,
Just
boleh tak?
unzip the jacket because it's tight, kan? So
Sometimes, okay, good, very good, correct. So sometimes passengers has the spectacles in their pocket, so you have to remove it also. So that is a possible danger on the casualty. How about your surrounding in the aircraft? What are the possible danger that you may have?
Loose item.
Loose item, example? The card, the drawers, any service equipment following a turbulence, everything will be flying around.
Yeah.
Okay, so you have to remove that away. So that is the danger that we're talking about. So before you render first aid, you must check for the danger on you, on the casualty, and on your surrounding. Next, what you need to do? Check for response. For what do you call it? For adult, how do you check response?
Are you scared for respiration?
Sir, are you okay, sir?
Good. Okay, for adult, you tap or shake shoulder. You ask, sir, are you okay? Are you alright? Child, boy, are you okay? Are you alright? For infant, tickle the feet. And then what do you say? You just say baby, don't say baby, are you okay? Are you alright? Suddenly the baby say, I'm okay, bro.
Jadi kaki pula.
Okay. Check for response. When you check for response, there is no response. What do you do next? You call for backup, rescue, help, inform. Remember? I need a witness, huh? Door up, door is up. Right. Okay, again. When you call for backup, you ask the backup to inform ICC, IC.
Bring the
Good, bring oxygen bottle, AED and
Page for
MFK. Page for
medical
professional. Done. Next, you need to check for respiration. Respiration consists of breathing and also pulse. When you check for pulse, remember unconscious, where do you check pulse? At the carotid. Okay? Check at the carotid. At the same time, you need to scan for breathing. How do you scan for breathing? What do you look into? Chest rise. You scan, meaning you see. Don't stare. Just because the lady is having G cup, don't stare. Ah. So, how long are you going to check?
I'm the one pregnant later.
Not more than 10 seconds. Now count with me. 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds, 6 seconds, 7 seconds, 8 seconds, 9 seconds, 10 seconds. So after you check, not more than 10 seconds, you may have the person that is not breathing and there is no pulse. So what do? CPR. No pulse, meaning that the heart stopped to pump. And no breathing, you straight away do CPR. Starts with chest compression. Okay? So chest compression, how many chest compression?
30 chest compression.
30 chest compression. Count with me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30.
Good. So the counting should be 1 to 10, 1 to 20, 1 to 30. When you're doing chest compression, you have to interlock your fingers. Make sure your arms are straight, and your shoulder go forward. Put all your weight here on your shoulder. Push hard and fast. Don't too slow, and you need to allow the chest to recoil. What does it mean by need to allow the chest to recoil? Meaning that after you push in it, you have to release it. Okay? Don't go halfway. Like that. You have to release everything. Okay? Alright. Now after 30 compression followed by 2 ventilation. But in order for you to give 2 ventilation, you have to open airway. Open airway. Now open airway with the method of head, tilt, chin lift. How do you do head, tilt, chin lift? One hand placed on the forehead. Another hand with 2 fingers. Put it at the bony part of the jaw. Lift it up at the same time. Don't do this. Habis the neck. Together at the same time. Okay? Now after you have opened the airway, in the first cycle you must check whether is there any foreign object or not. Because the person collapsed, you don't know what caused the person collapse. Maybe the person is choking. So you check. You already opened the airway. You check with the method of tongue jaw lift. Take your thumb, rest it against the tongue of the casualty. Open up and see. If you see something using these hands, remove it. Okay, using your thumb and index finger. Keep for evidence. Okay? But if you do not see anything, don't do this. Okay? You will actually promote further injury. So you just, if you see something, remove it. If you don't see anything, forget about it. Okay? Next, you give 2 ventilation. Okay? Continue second cycle. How many cycles you must perform in CPR? 5 cycles. Okay? Done. How many breathing that I gave just now? 2. D is for defibrillation. What is defibrillation? Your AD, which we are going to cover on day 2. Okay? So far, are we good?
Yes.
So you have got the idea what is Dr. Cat?
Yes.
It is actually DRCAPD, but we call it Dr. Cat. Okay? Alright. So let's recap again. Danger, check surrounding is safe to self, casualty and other passengers. If casualty is facing downward, turn the casualty on his back and you need to check for any injury. So if the person is suspected to have a head injury, you don't simply turn like that, because you need to stabilize the head. Okay? And you need to have few people for that, which you will learn on day 3. Okay. Next, you need to check for response. Tap shoulder of the casualty and ask loudly, are you okay? Are you alright? For baby, tickle the feet. Okay. Next, rescue. Help, inform ICC, inform PIC, page for qualified medical professional or doctor. And then bring MFK, oxygen bottle and AED. But if it's an infant, your casualty is infant, you only ask them to bring MFK and oxygen bottle. Why? Because we cannot use AED on infant. Okay? Next, check for respiration, breathing and pulse, not more than 10 seconds. After you check, if the casualty is breathing normally and there is pulse, put the casualty into recovery position and monitor vital sign. If the casualty is not breathing normally, but pulse is present, provide rescue breathing. And if the casualty is not breathing and no pulse, begin CPR. So we need to say, after you have checked for pulse and breathing, you will basically have whereby you get pulse, you get breathing. So what must you do?
Recovery position.
Good. Recovery position. And then when you check, there is no pulse, no breathing.
CPR.
Good. You perform CPR. But there will be occasion whereby you check, there is pulse, meaning that the heart is beating. But then the person, there is no breathing, you don't see the chest rise.
RP.
So what do you give?
Rescue breathing.
You give rescue breathing. Okay? So that's why you need to know what's the purpose of giving chest compression, what is the purpose of giving ventilation. So if the person has pulse, meaning to say the heart is beating, do you need to do chest compression? No need. But then the person is not breathing, so you only give breathing. Okay? So very easy. Only 3 conditions. Please remember. Alright? Next. Compression. If unconscious, not breathing, start CPR with chest compression. 30 compression followed by 2 ventilation. In 1 minute, you should have approximately 100 to 100 compression per minute. Push hard and fast, allowing chest to recoil. Airway, open airway with the method of head, tail, chin, lift. Okay, class? Head, tail. The one I showed you just now is head, tail, chin, lift. Okay? And then to prevent the tongue from falling back, for adult and child, gently place one hand on the forehead, tilt the head back with the other hand using 2 fingers placed on the bony part of the jaw. Right? But if let's say you suspect the person is having head, neck or spinal injury, you do not open airway using the head, tail, chin, lift method. You open the airway using jaw thrust method. How you do it? It's like this. You need to place yourself above the casualty's head. And then you put your elbow on the floor to open the airway. Like this. See or not? Okay? Yes, easy clap. Alright? So this one you do when you suspect the person is having yes, head, neck or spinal injury. Okay? So after you open airway, you check for foreign object. Do not do a finger sweep if there is nothing that you see. If there is something that you see, remove with index and thumb. And then do not press deeply into the soft tissue here, it will block the airway. Do not use thumb to lift the chin and do not close the casualty's mouth completely. If it's an infant, when you check, when you open, you can see something. How do you remove? You do not use your thumb and index because it's too big for the baby's mouth. You use little finger. Always take it towards you, because this item you have to take it and keep it for evidence. If you were to do it like this, it will terbang everywhere. Then later you need to go and do a treasure hunt. That's why always towards you. Whatever come out from the casualty's body, let it be for an object, blood, vomit, keep it for evidence. Okay, don't throw away. Right? Next, I already covered this. Open airway, foreign object, remove with little finger. Okay? Breathing, give 2 slow rescue breaths. If there is no chest rise, when you're giving breathing, at the same time you have to observe the chest rise. But after giving 2 rescue breaths, you don't see any chest rise. What do you need to do next? Reposition the head, give 2 more rescue breaths. Because why? Maybe on the initial part, you did not open the airway properly. Okay? And then take 1 second for each breath. Don't blow like this. You'll never get it. Okay, blow. Relax, okay? What is it?
Nothing. Say, the third picture look like someone.
Okay, now, let's talk about resuscitator. Whenever you need to use this resuscitator, you need to use your EC clamp. What is EC clamp? Everybody do this. This is your C, this is your E. Your C is supposed to be on the mask. Place it on the casualty, seal properly, and the E, you put it at the jaw to open the airway. Open the airway. Okay? E and C. So now this resuscitator, you can use it single operator of the resuscitator, or we can have also 2 rescuer resuscitator. Meaning to say, come Azli. Let's say she is the first rescuer. Remember, she needs to call for backup, help, inform ICC, PIC and all that. Let's say she perform CPR. Now I come here, I am the backup crew. So I'm alone. I come here, then I have here her, then I become the single rescuer resuscitator. So let's say after 30 compression, I will then give ventilation using this resuscitator. I use the EC clamp, C here, E here. Rest the back on my thigh, and then I just squeeze. 2. Okay? Maybe she can help me also for 2 rescuer. When she help me, she will squeeze the back. And now I open the airway using the jaw thrust method. Again, EC clamp, but this time my EC clamp with my 2 hands. Here. See? Can you see it? Yes. Alright, so remember, resuscitator, thank you, single rescuer and 2 rescuer. You have to make sure that you seal the mask properly and there is no obstruction in the airway. Okay, successful ventilation using resuscitator. Required an open and unobstructed airway, Educate, mask, seal, and proper ventilation. Alright, it is 2 rescuer. See, this is easy clamp. Open airway, jaw thrust method. The second rescuer will squeeze the bag. This is first rescue, the only rescuer. You have to place yourself above the casualty's head. Place mask over the nose and mouth of the casualty. Secure mask. Use the thumb and index finger to make the T on the side of the mask, pressing the edges of the mask to the face. Use the remaining 3 fingers to form E here. To lift the jaw open. And you also need to squeeze the bag. Not don't squeeze like that. Slowly, yeah. 1, like that. Okay? Done. Next, our resuscitator comes with HEPA filter. Okay? What is HEPA filter?
The one that we have in the aircraft?
The one that we have in the aircraft. Okay? You have HEPA filter at home.
Ah, the air purifier, right?
Air purifier. Okay? HEPA filter. To filter the expired air. Okay? So basically, when you have the HEPA filter, it's like that. You need to attach here and you attach the other hand and the hand here. Okay? But then, in some occasion, we do not provide the HEPA filter. Can this still be used?
Yes.
Yes. But you need to advise the rescuers that we do not have the HEPA filter. So any expired air coming out of the casualty, we are all exposed to it. Okay? So it depends on your discretion lah. Alright. So if you have HEPA filter, it's a bonus for you. Okay? Next, if the casualty is not breathing normally but has pulse, you need to give rescue breathing. How are you going to give rescue breathing? For adult, 1 breath every 5 seconds, total of 12 breaths per minute. Just now, let's say you check the respiration, 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds, 6 seconds, 7 seconds, 8 seconds, 9 seconds, 10 seconds. There is pulse but no breathing. So you give rescue breathing. For adult, rescue breathing is 1 breath every 5 seconds. So now I press 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds, 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds. So you blow and you count 5 seconds. One blow to another blow must be 5 seconds gap. Total of 12 breaths per minute. Now, if let's say you're using resuscitator, I'll teach you how to count so that you can keep track how many blows that I have already given. Okay, now you give 1 blow, you count 1 second, 2 seconds, 3 seconds, 4 seconds, 1. 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds, 2. 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds, 3. Until 12. There must be 12 breaths per minute. So after this 12 breaths per minute, what do you think you must do? Yes. You check pulse, you check breathing again. Whatever you want to do, you have to check. If you don't check, you don't know. Shall I perform CPR? Shall I give rescue breathing? You don't know, right? So you have to check for pulse and breathing. Now for adult and child, it's slightly different. For rescue breathing, for child and infant is 1 breath every
3 seconds.
3 seconds. Okay, so the counting will be, I cannot use this. So you blow lah. 1 second, 2 seconds, 3 seconds. 1 second, 2 seconds, 3 seconds. 1 second, 2 seconds, 3 seconds. Total of 20 breaths per minute. Assuming I have given 20 breaths per minute, what do I do next?
Check for breathing.
Very good. Check pulse and breathing. Infant, where do I check pulse?
Break here.
Break here. Here. 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds, 6 seconds, 7 seconds, 8 seconds, 9 seconds, 10 seconds. There is pulse, there is breathing. Put into recovery position. There is pulse, there is breathing, recovery position. Are we good so far? Yes. But good question. We are going to cover that one later. Ada topik for recovery position only, but since you come here now, I will show you lah. Recovery position for infant macam ni. Head must be slightly lower than the body and support the head. Okay, we're going to learn about this one further later. Alright. These are all the points that you need to remember. Okay, ratio compression to ventilation, it is 30 to 2. But when people were to ask you, what is the ratio of ventilation to compression? 2 to 30. How many cycles of CPR you must perform? 5 cycles. Depth of the compression, meaning to say, how deep you are going to compress the chest. For adult, at least 2 inches down. For child, approximately 2 inches down. For infant, approximately 1.5 inches. Rate of compression will be approximately 100 to 120 per minute. Rescue breathing covered already just now. Hand position. For adult, you use 2 heels of the hand interlock. Everyone, heels of the hand interlock. Where are you going to place this heel?
Breastbone, central chest.
On the breastbone, center of the chest. That is for adult. For child, you can use 1 hand or 2 heels of the hand, depending on the size. Asian kids, maybe 1 hand. Masaleh, children, maybe 2 heels of the hand, depending on the size. But if you were to use 1 hand, place 1 heel of the hand in the center of the chest, the other hand you place it gently on the forehead. But only this one moving, you know. Don't do this. This. 3 times you do center. Saya larang. Okay? So only place it gently. This one is moving. Okay, are we good?
Yes.
How about infant?
2 fingers, middle and ring.
Yeah. For infant, you use middle and ring finger. Easy to say. Have you seen Spider-Man?
Yes.
Normally when Spider-Man want to take out the web, Spider-Man will do this, right?
Yes.
So you terbalik, Kamila. Put here. Center of the chest. On the breastbone, the other hand placed gently on the forehead. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Okay, that's how you do it. Right. Next, your defibrillation will be doing on day 2, 80. Okay, now, how do you know your CPR is good? Sign of improvement in CPR. When there is breathing and pulse, when the casualty is revived. Okay, when the casualty is coughing, swallowing, retching or burping, when there is any movement. So you need to continue to monitor vital signs every 5 minutes. What are the vital signs again? Breathing, pulse, color of the skin, and level of the consciousness. And you also need to administer oxygen if it's necessary. Okay. But When do you think you need to discontinue? When do you think you need to stop?
When help has arrived.
When?
Help has arrived.
Very good. When there is help arrive. When there is no sign of life. After you have performed 30 minutes of CPR and the AED says no shock advice. When else?
When you are too tired.
When you are too tired, no point of you continuing because your CPR may not be a good one. When the scene is unsafe, you performing CPR, at the same time captain say, cabin crew please be seated due to turbulence. So you may stop and strap yourself. Okay? So this is where you need to continue when the casualty is revived. You already performed 3 cycles of CPR. Suddenly passenger wide awake. What happened? What happened? Wait, I already performed 3 cycles. I need to perform 5. No, you don't continue. Okay? You stop. Next, when it is relieved by qualified doctors. And when you are too exhausted, you continue. When it is pronounced dead by doctor, and when it is unsafe to continue, and also when it's presumed dead by if the CPR has been continued for 30 minutes or longer with no sign of life, and when there is no shock advice by the AE. So all these conditions you can stop performing CPR. Okay? Now recovery position. Just now we're talking about recovery position apa? Itu a recovery position. Okay? Put the casualty into recovery position when there is bleeding, when there is pulse. Why must you put into recovery position? To maintain open airway. For a person that is unconscious, they cannot control anything. Unconscious now, cannot control. If you put the person lay flat on the floor, the tongue will fall back. When the tongue falls back, when the tongue fall back, what's going to happen to the casualty? It will choke and block the tongue. So now that's why you put the person into recovery position, to prevent the tongue to fall back, and then to allow drainage of any fluid to come out from the mouth. Okay? So how do you put the person into recovery position? You kneel beside the casualty. Place the arm nearest to you alongside the head of the casualty. And then you place the other hand against his or her cheek and support. Remember, unconscious. Unconscious. When the person is unconscious, they cannot control that. So you have to put like that, you don't support, the hand will fall. And then, no, I tend to talk very fast, that's why. And then you need to bend the knee furthest to you. Turn the casualty towards you and you move backward as you turn. Okay? And then ensure the airway is open by tilting the head and flex the knee. I'm going to show it to you shortly. Okay? For after you put a person into recovery position, there are 2 things you must do. Number 1, monitor vital signs every 5 minutes. What are the vital signs again? Breathing, pulse, skin color, level of consciousness. And also, you need to change the recovery position every 30 minutes to improve blood circulation. Okay, please remember, after you put someone into recovery position, 2 things you must do. Check vital signs every 5 minutes and also change the recovery position every 30 minutes. Okay? For infant, how do you put the infant into recovery position? Just now, Iqbal asked me. So you need to cradle the infant into your arms with the head slightly tilted downwards. Okay? This position prevents him from choking on his tongue or from inhaling the vomit. Same thing, monitor vital signs every 5 minutes. Okay, so you have to know how to tell the mother to put the baby into recovery position. Because why? You are not going to put the baby into recovery position. What busy there so that I do not need to resume my duty. Okay? Done. Any questions? No question, confident. Everybody so confident. Okay? Sure, no question.
Oh, I have.
Shall we do a recap?
Yes.
Look at memory. Okay, early this morning we covered definition of first aid. Can you tell me the definition of first aid? Very good. Temporary, immediate and temporary care given to a casualty in the event of any medical incident happen on board. Correct? Until you can get medical help. Next, why is it important for cabin crew to train first aid?
Save lives.
Save life? No.
Required by
No. Because it is required by
law.
law, by the CAM, for you to be able to render first aid. You know the thorough knowledge of the first aid, you know the location of the first aid equipment, and also to exercise best judgment. Okay. Next, objective of first aid.
Preserve life.
Okay, very good. The 3 P's. Preserve life. Good. How about the qualities of a first aider? Care. C is for
Confident.
A. Resourceful. And E.
Efficient and empathy.
Good. Now, how do you collect information through?
Science.
History. And history. Rara, tell me one of the example of the sign that you can see. Skin. How about the skin? Skin flawless, not flawless.
Skin appearance, pale red or flush.
The color of the skin. What else, Azzy?
Breathing.
Breathing, next. Bleeding. Sweating. Shape. One more, Alika. Sign. Skin color done, breathing, bleeding, sweating, color of the skin, shape. One more is medic alert glow. Okay. How about symptom? What is symptom?
Something
Person feels.
Raj, what is it? Something what? What sensation?
We cannot see, but the person can feel.
Yeah. You can what feeling? What feeling? Is it a good feeling? Unpleasant feeling. Unpleasant feeling. Example.
Pain.
Dizzy. Fever.
Nausea.
Okay, good. Itchy. Okay. Now, next, how many do's that we have in first aid? 6. Tell me the first one. Okay, wash hand with soap and water. Good. Next, wear gloves.
Use everyone.
Allergies to medication. One more.
Ask for credentials and passages allergy
Credential. How many don'ts? 9. First one.
Give medicine not provided in the first aid.
Do not give any medication that is not provided in the first aid.
No injection.
No, do not administer injection.
Don't give food and drink.
Good. No food and drink to unconscious person.
Give medication to pregnant lady.
Don't give medication to a pregnant lady.
Do not accept medication or drugs.
Good.
from
Do
passengers.
not accept any medication for storage.
Don't offer. Do not discuss casualty.
Do not discuss casualty condition in front of them. Okay, do not offer medication for cabin crew or other passengers supply. Good. Alright. Next, normal breathing rate for child?
20
20 to 24 breaths per minute.
Good, 20 to 24 breaths per minute. Adult?
12 to 20 breaths per minute.
Infant?
24 to 28 breaths per minute.
Good. Alright. So now, how do you count breathing? How do you know a passenger is breathing? Someone is breathing.
Chest rise.
Chest rise. So when you count, do you count inhale 1, exhale 2? Exhale. Both inhale and exhale, you count 1. Correct. There will be a condition whereby a person that has abnormal breathing. Can you give example of abnormal breathing? Fast breathing, shallow, soft.
Heavy chest movement.
Noisy, heavy chest movement, wheezing. All this abnormal breathing is due to
Exercise, stress, fever,
stress,
shock, hemorrhage.
fever, hemorrhage, shock,
Asthma.
asthma. Okay. Next, how about pulse? What is pulse? Count of the heartbeat. How do you check pulse? Which fingers do you use? Index and middle finger. Can you use your thumb?
No.
Why not?
Artery.
Because the thumb has its own artery. Where do you check pulse on adult?
Carotid and radial.
Where is carotid?
Under the neck.
Where is radial?
Wrist.
Wrist. How about child? Where do you check for child?
Carotid and femoral.
Carotid and femoral. Infant?
Brachial.
At the back brachial. What is the normal pulse rate for infant?
120.
Good. Adult?
60.
Child?
Beats per minute.
Okay, beats per minute. Alright, good. How many first aid kit that we carry on board?
3.
Name me all 3. Okay, good. DFAK, MFAK, and EFAK. What is the procedure for you to use when using the DFAK? You can use daily. As in when you need to use. When you use, what must you do?
Right SRS.
Put in the system. Safety reporting system. How about MFAK? MFAK, you need permission from PIC. And this MFAK also, you need to? Okay, good. You need to bring down following emergency evacuation. Whatever you use, put it in the SRS. How about EMK? Okay, only to be used by medical professional. So after you make the PA, somebody says, I am a doctor. What must you do? You check credential. After that, you ask for permission from PIC. Who is PIC? Pilot in command. Alright, good. Procedures handling disease on board. Where do you place the deceased? Window. What do you do next? Fasten the belt.
Close the
eyes. And then? Okay. Cover the blanket. Neck down. What else? Inform PIC. Good.
documentation for documentation.
Okay, good. About documentation, 2 more just now. Handling the disease. Do you make announcement?
No.
Okay, you make sure that the passengers, the rest of the passengers is not alarmed, and then you try to relocate if it's possible. Okay, next, let's go into documentation. If there is death on board within Malaysia airspace, what are the documentation that you need to fill up? Elham, sana. 2. What are the documentation that you need to fill up within Malaysia? form will be aeration notification of death form. Alright, if it's happened outside Malaysia, you need only to fill up the aeration notification of death form. Now, how about childbirth within Malaysia? GPNLM 01 and also aeration notification of childbirth form. Outside Malaysia, only aeration. Done. Let's go into fainting. What is fainting? Loss of consciousness due to reduction of blood flow to the brain. Very good. So, fainting can be divided into two: fainting on the seat and fainting on the floor. Fainting on the seat. What is the treatment? Check the cap. Loosen tight clothing. Lean forward for 30 seconds. Towel on the forehead. If it's an obese or pregnant lady, brace position. For how long? 30 seconds. Now, fainted on the floor. Treatment?
Raise legs, loosen tight clothing,
Okay, drop the cap, loosen tight clothing, reassure, raise the leg. How high are you going to raise? Just above the heart level. Okay, and then put, what do you call it? Cold towel on the forehead. Shock, what is shock?
Loss of blood. Loss of collapse due to loss of blood.
It's a state of collapse due to loss of blood, a lot of blood. Okay, so now, what is the treatment for shock? The only difference between shock and fainted on the floor for the treatment is cover with blanket. Okay, good. Unconscious, meaning the person is not awake. Correct?
Yes.
Alright. So what is the treatment for unconscious?
Casually flat on the floor.
Place the casualty flat on the floor.
Check the cap.
Check the cap.
Carry external physical examination.
Okay.
Do not give anything.
Do not give anything by mouth. What else?
If breathing, please continue to recovery position.
Okay. If there is breathing, there is pulse, put into recovery position. If there's no breathing, there's no pulse, CPR. Okay, let's talk about CPR then. CPR, the full term of CPR is cardio means pulmonary lungs. Resuscitation is revive. Now, if let's say the heart is collapsed, the person is having cardiac arrest, how are you going to revive the heart? By giving chest compression. If the lungs collapse, how do you treat? You give ventilation. Now CPR, how many chest compression you must perform?
32.
How many ventilation?
2.
How many cycles?
5.
5 cycles. Within 1 minute, how many compression will be there?
120 compressions.
Approximately 100 to 120 compression per minute. Now let's talk about Dr. Cap. D is for
Danger.
Danger. Who do you check?
Surroundings, casualty, and
Good.
passengers.
You check yourself, casualty, and surroundings. And then next, what do you do? R.
Response, rescue, restoration.
How do you check response on a doubt?
Tap on the shoulder.
Tap shoulder.
Softly,
Are you okay? Are you alright? Child?
Same.
Are you okay, boy?
Boy, are you okay? Are you alright? Infant? Hey, baby, are you okay? Baby. Okay, that's it. And then next, if there is no response, what do you do?
Call for rescue.
Call for
Shout for
rescue.
help.
Help! Inform.
PIC, Inform ICC, page 4, qualified medical professional.
Good. Bring me.
MFAP, oxygen bottle, AED.
Infant.
No need AED.
No AED. Then next, what do you do?
Check for respiration, breathing
Check
and pulse.
respiration. How long?
Not more than 10 seconds.
Not more than 10 seconds. You check for pulse, at the same time you scan for breathing. When you check, there is no pulse, no breathing, what do you do?
Chest compression.
CPR, start with chest compression, 30 compression followed by 2 ventilation. But in order for you to give 2 ventilation, what must you do?
Head tilt, chin lift,
Open airway. Head tilt, chin lift. But if you suspect the person is having head, neck or spinal injury, how do you open the airways? Jaw thrust method. And then after that, you give 2 ventilation. When you give 2 ventilation, you need to observe the chest rise. If there is no chest rise, what do you do?
Reposition.
Reposition the head again, head tilt, chin lift again. And you give 2 more rescue breathing. Now, after you give 2 more rescue breathing, there is still no chest rise. What do you do?
Compression.
Continue second cycle of CPR. Start off with chest compression. If you want to check, no, as you give sampai bila the heart. Okay? Say no. Okay. Next, breathing. How many breathing just now? 2 breathing. You have to complete by 5 cycles. Done. Now, let's say after 5 cycles, you have performed CPR for 5 cycles. What do you do next?
Monitor for signs of life.
After you have completed 5 cycles, what do you do?
Check pulse.
Check pulse?
Check pulse, check breathing.
Yes, remember I told you, whatever you need, you want to do, you have to always check for pulse and breathing. Then only you can decide. Now you check, there is pulse, there is breathing. You put
Recovery position.
the recovery position. When you check, there is pulse but no breathing.
Give air ventilation, rescue breathing.
Rescue breathing for adult.
1 breath every 5 seconds.
Total
12
of?
breaths per minute.
For child and infant.
1 breath every 3 seconds, 20 breaths per minute.
Okay, after you have given 20 breaths per minute, what do you do?
Check monitor.
Check pulse,
Check breathing.
check breathing again. Then only you decide what to do. Now, let's say you have performed CPR. How do you know that your CPR is good? What are the signs of improvement in CPR?
Coughing.
When the person is coughing,
Movement, vomiting.
vomiting, burp, retching, coughing.
Yeah.
Okay, good. Now, after you have performed CPR for a few cycles, when do you think you need to stop?
When there's help, when help has arrived,
When help arrives,
too tired,
when you are too tired,
the area is unsafe,
when the area is unsafe, when there is no sign of life after you perform 30 minutes of CPR and there is no shock advised by the AED, when it is pronounced dead by medical
professionals.
one more, turbulence done,
Unsafe.
too tired, then finish off,
Yes.
done. Okay, good, thank you. So far, do you have any questions regarding today's topic? No? Okay, so I write down here all the important points. I put all together on this whiteboard, so be easy for you. This is all Dr. Cat. So danger, check danger, you, surrounding and casualty. Make sure the casualty laying flat, facing up, and you need to do body examine from head to toe, making sure there's any injury or not. And then next you check for response. Adult, touch shoulder, are you okay, are you alright? Child, for infant, tickle the feet, baby. Next you call for rescue. Help, don't say rescue, say help. Help, inform ICC, PIC, page medical professional, bring MFAK oxygen bottle and AED for child and adult, but for infant, you do not need AED. Next, you need to check for breathing and pulse, not more than 10 seconds. If there is no pulse, no breathing, you start off with compression. How many? 30. Hard and fast, and we place the heels on the breastbone, center of the chest. Adult, 2 heels. Child, 1 or 2. Infant, 2 fingers. Okay, the depth will be at least 2 inches down for adult, approximately 2 inches for child, approximately 1.5 inch for infant. The compression rate will be 100 to 120 per minute. And then next, we need to open airway. 2 methods, head till chin lift, or if the person has neck, head or spinal injury, jaw thrust method. After you open airway, you must check for foreign object. What method? Thumb jaw lift. Remember, when you're doing thumb jaw lift, make sure your thumb is maintained there. If let's say you see something and you need to remove, right? Can you use this hand?
No.
Why not?
Because you need to keep the
Mouth
mouth open.
Yeah, once I remove this hand, what happened to the lung? To the tongue. It will fall backwards. You cannot see the item anymore.
Yeah.
So you have to make sure you press. Remove it with another hand. Keep for evidence. Okay? And then next you give 2 rescue breathing. At the same time, you must observe the chest rise. If there is no chest rise, reposition the head and give 2 more rescue breathing. This one to be done only for the first cycle. Second, third, fourth, fifth cycle onwards, no need to reposition again. Continue. 2:30. 2:30.
This one is referring to
Chest rise. Okay? And then next is your defibrillation, which is your AED recover on day 2. Now this one, like I wrote down just now, okay, when you check for pulse and breathing, there will be only 3 conditions. When there is no breathing, there is no pulse, you perform CPR. When there is no breathing, but the person has pulse, the heart still breathing, but then the person cannot breathe on their own. You give rescue breathing. And then when there's breathing and there's pulse, you put into recovery position. When you put into recovery position, you have to check vital signs every 5 minutes and to change the position every 30 minutes. Your CPR consists of 30 compression, open airway, 2 ventilation. Complete for 5 cycles. After 5 cycles, check pulse, check breathing again. Your rescue breathing for adult, 1 breath every 5 cycles, total of
20 breaths a minute.
no. Terbalik. Terbalik, right? 1 breath every 5 cycles.
Yeah,
or
okay.
12. So after you have given a breath for a minute, you need to do, you have to check again for pulse and breathing. All good?
Yes.
Any questions? If not, then we'll do the practice for recovery position adult. Okay, come. I need 1 person to become my model. Model.
You choose this.
I choose them. I very baik one. I'll choose the smallest.
Who is the smallest here?
Bobo. Ah yes. Bobo di mana? Come. So if you cannot see, you can stand. Come on this part. I'll remove your name. Okay. So now, when do you put a person into recovery position?
When there's
There's pulse but no breathing.
Hey, already pulse. Got pulse and no breathing. Got pulse and no breathing.
Hey! I saw wrongly, No pulse, no breathing. Nee.
Okay.
There is pulse, there is breathing. So the person is come back, is okay already, it's just that they're still unconscious. So they cannot control their tongue. Right? So what must you do? You go next to the casualty. You take the hand nearest to you and put alongside at the head of the casualty. It's like the person is having an oath. No oath?
Yes.
Maka kami, Rakyat Malaysia. Okay. So another hand here. Put at the on the cheek, like the person is having toothache. Ow. Okay. At the same time, you need to support here at the shoulder, because remember the person is unconscious. If you don't support, the hand will fall back. Okay. So now next, take the knee furthest to you. Bend the. Unconscious ma. Into character. Okay. Take the knee furthest to you. Bend the knee, and now you pull the casualty towards you. At the same time, you need to go backwards. Okay, pull. Slowly. Boom. Okay, so now, first thing, open airway. How do you open airway? What method? What method to open airway?
Tongue jaw lift.
Open airway.
Jaw thrust.
Head till, chin lift. Head till, chin lift. Jaw thrust method for whom?
Spinal injury.
Imagine if she has spinal injury, do you think I can do this to her? No. Okay. So now I open airway using the method of head till, chin lift. Head till, chin lift. Done. Now, next, what I need to do, don't touch anywhere else. I just need to flex the knee, take this one, put it down, and I lift up. Okay, that's it. Okay, this is recovery position. Okay, good?
Yes.
Okay, now, done. Thank you, Bo. Okay, now I need you to do it one by one. I need one volunteer to be my monster there.
Dewi. Raj.
Come, thanks.
And Dewi.
My God.
Recovery lah. Okay, thanks. Okay, come. Remove your lanyard. Have you looked at Jeremy? Huh? You love Jeremy, right?
Yes, we do.
Love Jeremy.
Your dreams
Okay, remember, first thing, good. Go nearer, go nearer. Okay. Then, so who voted Jeremy just now? You regret, right?
Malu dengan dia lagi.
Hey, there.
Tadi gigi.
In character betul lah.
Jeremy, you are unconscious. Please be into character. Okay, next. Wait. Take another hand. Remember toothache? Where do you place it? Toothache. Support at the shoulder with this hand. Support with this hand. Support with this. Wait. Bend the knee. Bend the knee. Okay. And then here. Okay, and then you pull towards you slowly, pull towards you. Wait, pull je towards you, jangan kacau lagi. Next, open airway. Okay, good. Flex the knee. Okay, lift up a little bit. Use here. Jangan pula, sampai sini. Okay, done. Good. Next.
Aduh, Dewi naik.
Baring.
Semua Jeremy. Semua
Untung lah.
Dia orang muda.
Please in character.
Mata kami sakit gigi.
The lanyard will land somewhere. Bend the knee, bend dulu, don't pull. See, compared already.
Well, I can hear from outside.
Ini husband ni gila.
Kan lah, Rehat? Boleh lah. Okay, next. Class, remember one by one. Take the hand nearest to you. Put it like an O. The other one, toothache. And then bend the knee dulu before you pull. Okay.
Two hands.
Okay, support good. Wait. Bend the knee. Bend. Okay, bend. Okay, then you pull towards you slowly. Don't.
Done already.
No, not yet. Pull. You go to the back. Pull. Okay, then open away. Don't touch the buttock. Okay, here, touch here. Okay, put it down. Two hands. Done.
Okay.
Next.
Done.
On the aircon. Change the come on then.
Suddenly the unconscious person can talk.
Okay.
Jangan pull lagi, kesian kaki dia straight, badan dia sengit. Okay, bend the knee dulu. Alright, pull towards you slowly. Okay.
Jangan kasi keras kepala kau.
Jangan kasih keras kepala kau.
Okay, good. Next.
Merah sama aja.
Can change mangsa or not?
To the mangsa already red color in face.
Hampir change maksa lah.
Gorgeous, you could play. What can you?
Berat juga kau ni.
I feel so pity to Jeremy.
Please enjoy.
Okay, then thank you everyone. Okay, thank you. Are you okay? Alright, come. Alright, so that is the recovery position. So go back. You have to do your workbook. Okay, so make sure you do it. Complete your workbook is for you. Alright, and on day 2, we will practice on CPR. Before we dismiss, do you have any questions regarding what we have learned today? You learned a lot? Yes. Okay, very good. If you have any questions, you can always